Wow, I am so happy to be here with all of you today. As Mike said, this has been a long road and it's been an exciting one, and I have to go out with the best class ever, right? Right? So, okay. So Duke is rapidly changing and becoming more global and more interdisciplinary, and you guys, I put in the program 2 kids over here too, are a big part of that change. I was at a meeting once with administrators who called interdisciplinarity the signature Duke difference. They then described the certificates as the best showcase for interdisciplinarity at Duke, and we all know that the global health is the best certificate. All right, we'll go there. Okay, so I've been directing the certificate for 5 years, and over that time, I have been constantly taught what it means to study global health at Duke. Your wide-ranging intellectual interests come from all over campus, and I'm going to give the full list, so for the ones that weren't in Mike's speech. So you come to global health from biology, from public policy, from cultural anthropology, from chemistry, from international comparative studies, evolutionary anthropology, psychology, English, biomedical engineering, civil engineering, environmental science, history, linguistics, neurobiology, and Spanish. And I have to add that we have a UNC student who's getting his degree down the road, but he came to the right shade of blue to get his global health certificate. So this is the place to be. Okay. So you have taken all these diverse talents and backgrounds and learned to work together, which is the very heart of global health here at Duke. The economist working with the culture anthropologist, working with the doctor. In your capstone projects, you have examined significant global health challenges and worked together across disciplinary boundaries to devise solutions to improve the health of communities suffering from health inequalities. You have raised the bar really high for the guys coming after you. The capstone faculty reviewers commented that your work was better than much conducted at the graduate level. And I can say that because the master's students had their program this morning. Okay. So your projects have included an intervention to improve child labor in Cote d'Ivoire's chocolate industry, an analysis of sex trafficking in North Carolina, a culturally anchored intervention to improve the lives of epileptics in Laos, programs to improve sanitation in Bolivia, and creating an information program on the need for HPV vaccination for boys that has already been adopted by the Durham Public School System. And this is just a small amount of what you've accomplished in your senior year. You've made deep friendships here at Duke. Many of you have also become friends with community partners from Durham to China to Guatemala. Some of you have taught myself. Many of you have told me about your amazing experiences. All of you have fascinating paths ahead of you that we at DGHI will eagerly follow. Your plans are to go to graduate school, to get degrees in public health, global health, and advanced research. Some of you will be going to medical school. Others will be teaching, working for NGOs, for governmental organizations, or working overseas. Today you are launching, and we will be eagerly following your trajectory. But answer our emails when we want to find out what you're up to and are checking in. We want to know. So you're off on this great journey. Don't forget those you've left behind here. So you've been involved in the Global Health Certificate for 4 years. I have to point out that it's actually taken me 7 years to finish my work with the certificate. So once again, you guys are really setting a path. You've completed 18 different majors, 6 different minors. Today we proudly award you 37 Global Health Certificates. This is your weekend. I'm so glad we snagged you for the very first ceremony. It's all, I can't say downhill from here. It's going to be wonderful. No, it's like, we're so proud to have had you here first. I'll just end with that. Okay. Parents, thank you for sharing your children with us. Their drive, their intellectual curiosity, and their friendship is the heart of what makes it great to be here at Duke. So thank you. I get to just stay up here. I now get to announce the award for the best senior capstone project. Throughout the certificate, we reinforce the need for teamwork in synthesizing material across disciplines. And the culminating element of the certificate is our senior capstone seminar, where students devise real-world solutions to pressing global health problems, and then they present them for faculty for review. Parents, all of the posters for the Capstone projects will be on display during the reception. I urge you to look at them. There's fascinating work that has been produced here. Last year, we began the tradition of awarding the Capstone Award for the Best Capstone Project, and the names of the winning students are engraved forever on a plaque that hangs in the lobby of DGHI, and some new names will be joining them today. Okay. So each Capstone professor nominated 2 projects, and then an independent committee reviewed them and selected the winner. We are looking for a project that highlighted the signature features of the Global Health Certificate, which are problem identification, interdisciplinarity, ethical approaches to partnering with communities, use of appropriate methodologies, and working effectively in teams. This was incredibly challenging given the high quality of the projects. But this year's Capstone Award goes to Katie Budolfson, Daniela Choi, Mab Ibrahim, Sonia Katharia, and Katya Papatla for their project, and they'll come up in a minute, we can clap, for their project, The Extent of Sex Trafficking in North Carolina, Framework for Better Data Collection. So these students originally wanted to design an intervention on sex trafficking in North Carolina, but soon realized that there wasn't sufficient data and that there was a lack of coordination between various stakeholders. So, being intrepid Duke students, they contacted the FBI and state legislatures and supportive NGOs to create a framework to understand the full nature of the problem. I am incredibly proud to say that the work that these students created is now being used by Senator Ellie Kennard to advocate for a new statewide commission to analyze sex trafficking in North Carolina. So please come forward.